So the service we provide for MRI before biopsy is that we get the referral from the GP. We then try and assess whether we can see them on a one-stop basis or not. And we have a one-stop clinic where patients are seen in the morning for an MRI scan. They're then reviewed clinically, and if it's felt appropriate, having read the MRI scan, they then have a biopsy on the same day, targeted by the MRI scan output. Otherwise, they can be seen on a two-stop basis and be seen clinically before they have an MRI ordered or a biopsy. But we're finding, hopefully, that people are a bit more quickly and more efficiently put through the one-stop clinic. The inspiration for doing this really is to try and improve the quality and speed of patients accessing the service and a quick, efficient diagnosis of prostate cancer, and they can move forward then to treatment if necessary.
The PROMISE study that was undertaken at University College Hospital in London, the results of that showed that we might do perhaps a quarter less biopsies because those patients with an elevated PSA didn't need a biopsy because they were at very low risk of prostate cancer. It also showed that perhaps about 20% more cancers might be found. These are really amazing figures, and this is a particularly important study and was the reason that, well, one of the main reasons that spurred us on to introducing multiparametric MRI. We would hope that we'd have similar findings here, but we haven't formally audited it at the moment, and I think we'll have to wait and see if we can achieve the very promising results that were reported from University College Hospital London.
So we think the benefits for the patients referred are, well, hopefully quicker speed through the system. We're hoping that that's the case, certainly for the one-stop patients it seems to be. But we're also hoping that it will reduce the total burden of biopsies. So in the period of time we're entering when antibiotics are losing their grip on a lot of common bacteria, then, you know, biopsies through a dirty part of the body can cause serious problems with infection. And, you know, if you can avoid that unnecessary biopsy, hopefully you can avoid a lot of problems that the patients are likely to get from that. So anything I think that can, in a safe way, reduce the number of biopsies we're doing has got to be good for patients generally.
There are many challenges related to the introduction of a multiparametric MRI service before prostate biopsy. Perhaps the biggest challenge is in the use of the MRI. Using an MRI scanner isn't just like pressing a button and out come the pictures. There's a lot of background work that goes on, tweaking it here, tweaking it there to get the sequences optimized, and this shouldn't be underestimated. Reporting prostate MRI needs a specialist uroradiologist. In this trust here we have 30 radiologists. We're very fortunate we haven't got a shortage. But we've only got 3 of us who read prostate MRI scans out of the 30. So it isn't any radiologist who will be able to read these scans.
Well, my role in the work is being the clinical nurse specialist for the patients that come to the urology department here. I am their key worker as well. So I've met the men from the time they come into the first clinic appointment until they're being diagnosed. So my part of the role really has been to maintain that continuity, to maintain the patient's information so that at any stage when they come in for the department, to the hospital, the MRI, biopsy, they have the continuity of myself and my colleague. The introduction of the multiparametric MRI has improved outcomes for the men as they need to not have so many investigations. It's given them the investigation that promotes the targeted biopsy in particular, so it prevents them from having to have repeated biopsies. It then prevents them having the risks that come along with the biopsy, the increased risk of infection being one in particular. and it answers a lot of questions for their journey as well. So they have the MRI scan, there's information from that MRI scan that I can pass on to them. I can explain to them why they're needing to have the biopsy or why they're not needing to have the biopsy. So again, it's information that they need to have to be able to consent for the next step of the investigation, which would be the prostate biopsy. The use of the multiparametric MRI has improved our role and our service provision, because as clinical nurse specialists, we're not only involved with patients when they're coming in to be diagnosed, we're also involved with the follow-up of the patients. So if we have an MRI scan that has shown that there isn't a significant disease, then we can reassure the patients that the biopsy result they have had fits in with the MRI. It's almost, and I say to the men, it's like having a jigsaw puzzle really. When you come into the department, you put all the pieces together, get the information you need, and then be able to plan the treatment that they need. So it has helped our role because it's extra evidence to support our practice, and our practice has to be evidence-based. I think multiparametric MRIs should be adopted throughout Wales. I think the technology is there. I think it's available in some areas in Wales and it should be available throughout Wales. We can't allow the men in Wales to have a disparity of service. Why should somebody living in North Wales not have access to something that's available in South Wales? It's not right, and it's something that needs to be available to all.
The mpMRI scan was absolutely no problem at all. The staff that performed the procedure were very, very helpful, explained what was going on. They explained to me about going into a tunnel, which for me personally wasn't a problem. During the procedure, I had headphones on, so they explained everything that was taking place, and in between even played some music to relax me. I would say that listen to the advice that you will be given, and if you are given the option of an mpMRI scan, then that is definitely the way forward, because when the results do come, you will be told exactly what is going on and what further procedures, if any, will be necessary. An mpMRI scan should not be a postcode lottery in Wales. It should be available to all patients. It is by far the best diagnostic tool available to give an accurate picture of any problems in the prostate area, and obviously could avoid a high percentage of men going through an unnecessary biopsy.